from the ABC News Special Report because St. Louis County officials are now holding their own briefing. So let's go live to the Government Services Center in Duluth.
By Amy Westbrook and Dr. Nick Van Deelen. Amy is the head of public health for St. Louis County, and Dr. Van Deelen is the head of St. Luke's medical director. First, I want to say we're here to announce the first case in St. Louis County of the coronavirus. With this is something we've anticipated and we're preparing for. I want to give out special thanks to those in the community that are working now 7-8 days, 10-15 hours a day, preparing for what's coming next, and I can't ask enough for them. With that, I know there's fear in our community, but I know we have a very strong community. I want to give best wishes for this individual that is going through this, for her and her family, and to know that we are working around the clock to keep our community safe. With that, I'm going to introduce Amy Westbrook, who's going to talk a little bit more about the case.
Good morning. Thank you, Commissioner Boyle. I'm Amy Westbrook. I oversee the Public Health Division for Public Health and Human Services. A little bit about the situation. I want to stress that this is not a acquired community transmission. This is an individual who's in her late 60s who contracted the virus through domestic travel, not community spread. She has no underlying health conditions, and good news, she is recovering from home. As a public health system, we're monitoring her health status and as well as her close contacts. She is isolating at home, and the close contacts are also quarantined at home. We have not, as a county, been asked to provide any essential services. So this doesn't change our planning and response to COVID-19 as a county and with community partners. We have been acting on the assumption that we have COVID-19, it just hasn't been identified in St. Louis County. We want to reiterate the public health message that it's good public health practice for doing what you can as an individual, and we are all doing what we can as a community to make sure that we're planning and responding to the COVID-19 virus as closely with our community partners as possible. We know that St. Louis County is a large county, and we recognize that many people will be curious as to where exactly this individual resides. In reality, the recommendations remain the same, regardless of where this individual lives in the county. So we want to reiterate the public health messages and the prevention and control messages, which Dr. Van Deelen will review. And we're all recommending to take the same precautions. We continue to work, as Commissioner Boyle said, around the clock with community partners in preparing, planning, and responding to this situation. We know it's affecting all aspects of our community, not just our public health, and we recognize that this is a really nervous, frustrating time for all of us. We're pulling together with community partners and doing the best we can possible with all of our community partners and making sure that everyone has the information, the recommendations, and are working from the same sort of coordinated process. Thank you.
Thanks, Amy. Thanks, Commissioner Boyle. I'm Nick Van Deelen, Chief Medical Officer at St. Luke's, and I'm a practicing emergency physician. So I guess the first thing I'd like to say is that while we do have our first case in St. Louis County, we knew this was coming. We're not particularly surprised by it, and we're prepared to manage it. So I think it's important to recognize that fact. I want to speak briefly, as Amy alluded to, to what we can do to protect ourselves and to try and diminish the spread in our community. So the most important thing we can do as individuals is to pay really close attention to basic hygiene. Wash your hands frequently. Dr. Pryor, my partner at Essentia, keeps talking about you have to sing the birthday song twice for it to work. That's a good reminder. The hand sanitizer, if you can get it, works well too. Don't touch your face. Cover your cough. If you're healthy, don't go out. When I say that, I mean don't get together with a bunch of people you don't know, even 10 people. We talk about social distancing. Keep about 6 feet between you and another person. I'm going to get to that a little bit later. It is important to go out, to take a walk. We're becoming very isolated, and that's really not necessary. If you're ill, you don't necessarily have to be seen by a provider. And I guess I want to be real specific about that. So we're still in the season of influenza. We have many respiratory viruses around which behave very similar to the coronavirus. And we have to remember that this coronavirus, the vast majority of patients will be fine. They'll have symptoms like a really, really bad cold, and some will have symptoms that won't be like much at all. If you are healthy and you have what seems like a bad cold, but you're otherwise doing well, you're able to breathe, you're able to eat and drink, you should stay home. You should not seek medical care. You should isolate yourself away from other family members, and you should be very deliberate about washing your hands, wiping off doorknobs. If you can, and you have to be out and around other people, wear a mask. If you can't wear a mask, wear a bandana. Those are all preventative measures that will protect the others around you and diminish the spread. So I want to talk just briefly about testing. Testing in Duluth and really throughout the country remains difficult. We have the swabs and we have the kits, but they can't be performed in the labs that we send them to. There are basically 3 labs that we're able to get them to in the state of Minnesota right now. At least that's the latest message I have from my lab director. They don't have the reagents, the chemicals needed to do the tests. So the turnaround time is days, anywhere from 2 to 5 days. So we're only testing very specific populations. So if you think, I'm going to go down to the emergency department or urgent care and get a test, that's not necessarily the case. So who gets tested? If you are sick enough to be admitted to the hospital with a respiratory illness, we will test you for COVID-19. If you are a healthcare worker and you're sick, or a first responder and you're sick, we'll test you for COVID-19. If you are sick and you live in a congregate facility, and by that I mean nursing home, group home, any place where there are many individuals living together, we're going to test you for COVID-19. Again, remember, the results are going to take a couple days to come back. Those are the only people we can test right now. I just want to take a minute to talk about the healthcare in this region. And I've practiced medicine for 23 years in town here, so we've seen a lot of change in that time. We are witnessing a level of collaboration that I have not seen for years, and it's really incredible. I know we're working closely with our critical access partners, but St. Luke's and Essentia are also sharing multiple things. We talk daily. We're sharing educational materials. We talk about how we can utilize our staffs together. We share opportunities that we each identify to try and find more swabs or more material or more PPE. It's really a credit to this community. So I guess I'd end by talking about healthcare by just saying this. And I'm not just talking about St. Luke's and Essentia. We are blessed in this region to have fantastic health care. And we are prepared, and we will be there for you. I guess the last thing that I would say is that this is a stressful time. It's stressful for all of us. And, you know, we're all working through it. It's easy when you're told to stay home to hide, right? Our fears and our anxieties are only magnified by spending too much time watching TV. Can't seem to get away from the news, right? So I think it's important that while we're thinking about the medical side of this, we also have to think about our mental health, right? And what can you do? Well, the sun's outside, take a walk, okay? Meet your neighbors. Stay 6 feet away, but talk to them. You have the opportunity now to reconnect with people. We're all at home, right? Well, not all of us. Many of us are at home. We have ways to electronically communicate. Skype, Facebook. My daughters have to tell me about this because I can't do it. But even a phone, right? Call your parents, call your siblings, call your friends. Talk to people. We're all in this together. I guess finally, I'd just like to say thank you to the community. I know both healthcare systems in town are getting incredible gifts. Gifts in kind like masks and protective equipment, food. We have people sewing masks, and most importantly, your thoughts and prayers. We'll get through this because we're such a great community. Thanks.
We'll open it up for any questions for any of us.
Yeah, no, I know you guys mentioned you guys can't obviously release what city it is in. Don't you guys feel like the public should know kind of what city it is? I guess what are precautions you guys are taking to kind of keep that information?
I'll let Amy finish it up, but out of respect for this woman and her family, she deserves that privacy, is the first thing I'll say. Amy?
Yeah, like I said, we do recognize that people will want to know where exactly this person was identified to, and lives. It doesn't change what we're recommending. So due to confidentiality and the fact that we want St. Louis County residents across the county, regardless of where they live, to practice exactly what Dr. Van Dielen talked about. I would also strongly encourage getting enough sleep, drinking enough water, and taking care of yourself, like Dr. Van Dielen said, mentally and physically. That's key all the time, and especially right now. So I recognize that people across the county will want to know if this individual is in their specific community. But I think that detracts from the message we want to send.
Can you disclose what symptoms, like how she qualified for the testing?
That's a good question. So currently the priority groups include healthcare workers, individuals living in congregate care settings, and individuals who are hospitalized. Those were narrowed to those three groups. Gosh, the days run together. Just a few days ago. And this individual was tested before those criteria were enacted. So because this is travel related, the previous broader guidelines, she was included in those testing groups.
Can you disclose what day she was tested?
I don't exactly remember. It was before the testing guidelines, and Dr. Van Dielen, you probably remember exactly when those testing guidelines changed.
Oh, it was early this past week, maybe end of the week before, actually. I don't, it has been maybe 5 to 7 days that we've been using the really restrictive testing guidelines.
Yeah.
So because she traveled domestically, contracted the virus, will you release where she went, and will you be taking extra measures for domestic travelers going forward?
Will we be taking, I'm sorry,
In terms of allowing domestic travelers to be tested, or maybe screening domestic travelers at the airport, are there any measures like that going forward?
well,
Yeah, so the CDC does, if you go on their website, they rate different geographical locations as to their risk. And at least in regards to our employees, we're using that to help guide how we judge their risk. We know that we have community spread in multiple areas across the United States. So we, as providers, we know that that is a risk factor for COVID-19, but that is not, because of the limitations on testing, it is not within the category that would prompt us to test. We may still think, yeah, that's a person with COVID-19, but we're going to treat them the same way. If they're admitted to the hospital, we'll test them. If they're healthy enough to go home, we'll reassure them and have them self-isolate at home.
Do you guys believe there are other cases that haven't been confirmed in the county? We've heard kind of, the days that it's taking for the testing kits, the lack of testing kits. How is that process coming along?
I think it's very possible. We have a lot of people who've recently traveled outside of the region for spring break. Some of us like to leave, northern Minnesota in the spring. Again, the reality is that for many of us, this will be a mild illness, like a cold, and we won't think twice about it. So there may be.
What did you guys, did you want to touch on that?
I just wanted to branch off of Dr. Van Dielen. I mean, one of the biggest issues we have is one of the tools that we have at our forefront is isolation, and we continue to measure that as best as possible. In our community, I think we have up to now almost a third of our community that is in isolation, and we can't put enough pressure on those to continue to monitor and be in isolation. You can't have play dates with your children, even though I know they're going stir crazy. I got a 13-year-old daughter that junior high is all about being with your peers, but it's really, really so important that we set that standard as a family. And it's about protecting our loved ones that are highest at risk. It's about our grandparents. It's about those with coexisting conditions. That's who we have to put in the back of our head to move forward on this and fight this moving forward.
When did the county find out about this case when you guys were going up that?
Yesterday.
It was last night. MDH notifies each jurisdiction sort of on a regular business day schedule. They were doing most of the notifications of the newly confirmed cases late yesterday afternoon into the evening.
How far along are you guys in figuring out if this person would have had any contact with community members?
Yeah, all of those interviews we do as a public health system in St. Louis County. The Minnesota Department of Health is the first point of contact for all individuals who are confirmed to be infected with COVID-19. We do the public health system does an extensive first point of contact interview. We ask about all potential contacts, and this individual reported very few contacts, only household contacts.
So then it's only household contacts who are asked to, quarantine themselves?
Correct. Mm-hmm.
Is the county looking to receive more tests in the future? Do you guys happen to know if they're on the way or whatnot?
I'll defer that to Dr. Van Dielen.
So the testing, what I'll do is I'll give you the lay of the land for right now, because this literally changes daily. Our testing challenge has primarily been around having enough of the equipment to do the tests. So early in the week, or end of last week now, we couldn't get enough swabs. That was the St. Luke's experience. Not other places were having trouble with the reagents. So we called each other and we swap and we work things out. Now, I would say that, especially in northern Minnesota, we have the swabs, we have the kits, we don't have the reagents, again, the material that is needed to do the tests at the testing site, whether it's at the state lab or the Mayo Clinic or Quest Labs. And so the turnaround time has kept creeping up. And so we are, it's not that, so if the question is, would we like more tests? Yes, we would like the ability to get more tests processed. Do we have any guidance in regards to when that might happen? Not to my knowledge.
So you have a limited set of data because you have a lack of tests. And so how does that affect your modeling for planning going into the future?
So, and I'll talk briefly and then I'll let Amy finish. So I think in the absence of tests, we have public health measures. And that's what we've been trying to say. I think Patrick did a great job of really reinforcing the social isolation, social distancing importance. If you haven't paid attention yet, because you thought it wasn't coming to Duluth, it's here. So time to stay home. Again, check on your neighbor, stay 6 feet away, take a walk, greet people. But the isolation is important, as well as the other measures we talked about. We are looking at different surveillance ways to try and track disease prevalence in our community. You want to speak to that, Amy? You don't have to.
Yeah, that kind of sums it up. We are exploring ways because because there is a lack of testing. We are looking at other methods to understand the burden of respiratory illness in our county and in our region. So we're looking at partnering with the healthcare systems in that, but it is something that I see as important, surveilling our respiratory illness burden in the county and the region just for that purpose. So we know sort of how the burden of disease, basically.
So and maybe I can just kind of add to that. We think we're starting to get to the end of influenza season. If you look at the MDH website, that's tracked pretty closely, and you can see it starting to trail off. So what we're looking for is, are we going to start to see an uptick? Well, if we start to see it, it may very well be COVID-19. So that's kind of just a simple emergency physician's approach to understanding that. So.
Other questions?
How are you guys working to take care of people in the healthcare industry as they work these long hours and help everyone?
So that's a great question. I think, it's first I'd say, I am just privileged to work with incredible people. It is a really challenging time right now because as we stop all elective procedures and routine office visits, and that's really done to protect people. That's done in keeping with social isolation. That has resulted in incredible upheaval, as you can imagine, throughout our organizations. Just like all of the other great businesses in town, our business has dried up for the time being. And we know that in a couple weeks, there is the potential that we may be busier than we've ever been. I say maybe. Again, we're doing everything we can to manage that. So it is a challenge, and I know we are working with our partners throughout Minnesota, the Minnesota Hospital Association, with our partners at Essentia, trying to plan for how do we manage this lack of need right now, and then how do we plan once the need starts to pick up to quickly and efficiently and appropriately get people into places where they can do the most I think we've included our behavioral health section into helping to address some of the self-care, the fears, the anxieties that we're all struggling with. That's where a lot of the support from the community has been helpful. I think PPE, you hear that term a lot, that's personal protective equipment. That's an area of anxiety and stress in our organizations. We are scrambling as hard as we can to find additional PPE. In fact, I spent a fair amount of my time this morning on the phone with a friend from New York City trying to find some in China. So I think that's a long answer. The short answer is it's a stressful time. We are working through it as best we can, and we are extremely appreciative of the work that our healthcare workers have done and will do, and we're confident that as this progresses, they'll be there for you.
Do you recommend that healthcare workers take any additional sort of isolating or, I guess, quarantine measures since they're working so closely with sick people?
So we are very specific about personal protective gear, when it's indicated, how you put it on, how you take it off. We have directives that we use from MDH and CDC that help us determine when an employee should be quarantined, and we adhere to those directives.
Other questions? Seeing none, thank you.
You've been watching a press conference held by St. Louis County officials. Now to recap, health officials have just confirmed the first case of the new coronavirus in St. Louis County. The case is from a woman in her late 60s. She acquired the case through domestic travel and not by community transmission. Health officials were not able to say, however, where in the county the woman resides, citing her privacy. Now, this comes after cases were already confirmed in Douglas and Bayfield counties. We will continue to track all the developments this afternoon and bring you updates as they happen on the WDIO website and on WDIO News. And I will see you again for WDIO News at 6 o'clock. For now, let's head over to ABC News with the special report.
This has been a WDIO News special report.